Hello and welcome to another special interview on the Think Tank's Wellcast, where I pose 5 important questions to the leading political voices in India. This is Karan Dev, and I'm very excited for the conversation I'm about to have today, not only because of the stature of my guest, but also because of the wealth of experience which he possesses as a member of parliament and prior to that as a business leader. India and the world are going through a very challenging period, and I can't think of a better time to have this conversation with Mr. Jayant Sinha, who is a second-term member of parliament from the state of Jharkhand. He is the chairman of the Parliamentary Standing Committee on Finance and leads the 31-member parliamentary panel that has oversight of the Ministries of Finance, Corporate Affairs, and the Niti Aayog, which is the government planning agency. He is one of the most active members of parliament and most recently in the 2021 budget session introduced the Climate Change Net Zero Carbon Private Member Bill. Previously, Mr. Sinha served as India's Minister of State for Finance and then as Minister of State for Civil Aviation, where he spearheaded a number of landmark policies such as the Bankruptcy Code to establishing India's sovereign wealth fund called the National Infrastructure Investment Fund, and then to privatizing multiple airports under an entirely new regulatory framework. As I mentioned before, he is also a highly accomplished business leader, and prior to his public service, Mr. Sinha served as partner and managing director at Umadiyar Network India, and before that as managing director at Courage Capital Management. And he also spent 12 years at McKinsey & Company, where he was a partner in the Boston and New Delhi offices. Mr. Sinha, it is a pleasure to speak with you on the Think Tank's Wellcast, and I'm looking forward to hearing your thoughts on the questions which follow. Mr. Sinha, the primary question on everyone's mind is, given the scale of the current surge in COVID-19 cases, the vaccine rollout is believed to be the silver lining. However, concerns have been raised about the pricing and the production budget being borne by private companies, as well as the capacity of states to carry out the vaccination drive. Taking all of this into consideration, what is your reading of the current crisis? Secondly, Mr. Sinha, if we were to go back in history, especially in Britain after the Second World War, the post-war economist Lord William Beveridge was credited for stirring the economy out of unemployment and conceptualizing welfare policies which really stood the test of time. And similarly, in the United States, Franklin D. Roosevelt was credited for some of the most forward-thinking ways in coming up with firm social security measures which bolstered the US economy at the time. What is the roadmap for India's social security system as you see it post the pandemic? Sticking with the theme of the economy on a global level, Mr. Sinha, the world as we know it is dealing with an unprecedented recession which is quite unlike the 2008 crisis or the dot-com bubble. There has been an increase in the concentration of wealth, which is a common theme across many countries. And therefore, economists like Thomas Piketty and Joseph Stiglitz have proposed the introduction of a wealth tax, as well as the enactment of a universal basic income scheme across the globe. What do you make of these ideas? Moving on to foreign policy, Mr. Sinha, the relationship between the United States and India has come a long way, especially in the last couple of decades. There have been many strategic business alliances, as well as a greater engagement in terms of trade. What are some of the opportunities which you see in the Indo-US partnership going forward, especially under the present administration of President Joe Biden, as well as taking into account the US-China trade war? Lastly, Mr. Sinha, you have personally led several policy initiatives in many sectors which are truly global in its vision. And the most recent example of that is the Climate Change Bill, which you introduced in the budget session. As a renowned policymaker and former management consultant, can you speak to the intersection of both of these worlds in shaping your thinking and ideology around the framing of policies? And with that, Mr. Sinha, I will conclude this conversation at the end of the answer session. But I want to thank you in advance for speaking with me on Swell this evening, and I'm really looking forward to your responses.
This is an unprecedented crisis that we as a country are grappling with right now. I do not believe since partition that we've had to deal with something of this scale and scope in terms of the humanitarian impact that it is having across the country. So this is truly an unprecedented situation, and it requires all of us, the state as well as all of society, to come together to deal with this in an appropriate manner. Even as we are doing this, and of course the speed and scale of this crisis has been quite unprecedented, we really have to focus on, I think, three very important areas. The first area that we need to focus on is to further strengthen our healthcare system so that we have the hospital beds, the oxygen supply, the necessary drugs, the ventilators, all of the necessary facilities and equipment that are necessary to absorb the COVID load that is coming at us. So I think that's the first area that we need to concentrate on. The second area that we need to pay attention to is to ensure that people are appropriately informed, that there is no panic, that they understand that the vast majority of cases, maybe somewhere between 95 to 99% of the cases, are going to be dealt with at home, that there are good remedies for people who are COVID positive to be taken at home, and that they will then be cured by just following these simple remedies. So we need to make sure that people are well informed about these remedies, they're well informed how to look after themselves, and it's only a small minority of cases that require hospitalization, and for that, as I said, the first priority was to strengthen our healthcare system so that we can take care of the people that need to be hospitalized. So that's the second area, which is to make sure that people are well informed, that they understand what needs to be done, and that they don't panic and create a worse situation simply because of their panicking. So that's the second focus area for us. The third focus area, of course, has to be that we take very good care of our medical staff, our doctors, our nurses, our ward boys, and so on, that are doing such heroic work in terms of looking after corona patients. So we really need to make sure that our medical staff is well looked after, that they are given the rest that they need, they're given the resources and the supplies that they need to be able to look after their patients well. So that is the third priority that we need to deal with immediately. And even as we are looking after COVID patients, both those who are at home as well as those who are in hospital, what we also need to do is at the same time ramp up the vaccination program, create enough flexibility in the vaccination program so that everybody can get vaccines as quickly as possible. Once we are able to roll out the vaccines, and we should of course have a diversity of different vaccines, whether it is Covishield, Covaxin, whether it is the Sputnik vaccine coming from Russia or the J&J vaccine, that is a single shot vaccine that's been developed. We need to make sure that everybody has access to all these different vaccines as soon as possible. They recognize that it's very important to get vaccinated, because as the population gets vaccinated and we move towards herd immunity through the vaccine route, we will be able to get this pandemic under control. And it is, of course, a race against the evolution and the development of the virus as well, because I think part of the reason why the speed and scale of this pandemic at this point has been so unprecedented, it's because there are new variants that have developed that are both more transmissible as well as more lethal. And so we have to make sure that we get our vaccinations done as quickly as possible. So all in all, an unprecedented crisis. It is a crisis that we had recognized might happen because of the second wave. But I think what has turbocharged the second wave are these variants that have made it much more difficult to handle. But as long as the state and all of society work together, we avoid panic and we strengthen our healthcare system, I think we'll be able to get through it. We have undertaken a number of very major initiatives over the last 7 years to build out India's social security system. And I think one of the signature achievements of Honorable Prime Minister Narendra Modi ji's government has been building out India's social security system. We started, of course, with the JAM Trinity, which was Jan Dhan, Aadhaar, and the mobile phone. And as a result of that, with this JAM Trinity, we were able to direct social security payments very, very specifically to people's bank accounts and make sure that there was no leakage in the system, that the monies that had to go to people were going to them directly. So we built the JAM Trinity. Once we did that, we were able to launch a series of programs, such as, for example, the Kisan Samman Nidhi, where 6,000 rupees through 3 installments, 2,000 rupees each, were given to farmers. So the Kisan Samman Nidhi became a very powerful way of providing support to farmers. The Narega payments could also be done through the JAM Trinity, the social security platform that we had built. And then, of course, we have been able to support people through this terrible COVID pandemic by making payments into Jan Dhan accounts. So a number of different social security mechanisms could be activated once we had built the JAM Trinity, the Jan Dhan based ability to be able to send money directly into people's accounts. And of course, because we had done that, we could then launch a program like Ayushman Bharat that provides 5 lakh rupees worth of healthcare insurance to everyone. So these were all ways in which the social security system has been built up over the next 7 years. Now, post the pandemic, I think we will have to do a variety of things to further enhance and improve the social security system. One is, I do believe that we will have to further strengthen health insurance so that people can make cashless payments when they're admitted to hospitals, that hospitals will be able to charge directly to the National Health Authority and get paid as well, so that they don't have a receivables problem as well. And this will be treated not just for tertiary care, which is essentially what Ayushman Bharat is for, is when you have to be hospitalized. But this will be treated and used, I hope, for wellness programs also. So we will strengthen the healthcare aspect of the social security system quite a bit. Excuse me. In addition to that, there will be, I'm sure, further income support programs like Manrega exists right now in the rural areas for the urban areas as well, so that migrant workers, urban workers find a level of support through these kinds of make work programs. So an urban Narega is also quite possible. I have long been an advocate of having an urban Narega so that we can provide income support to people in urban areas, just like we provide it in rural areas. So that's a second way in which our social security system can be strengthened. And third, I think we should consider ways in which we can further streamline our subsidies so that instead of doing them in kind like we do for some of the farmer programs like a fertilizer subsidy, that instead we deliver that through direct cash payments like we are doing with the Kisan Samman Nidhi. So potentially we can increase the Kisan Samman Nidhi, provide more than 6,000 rupees and reduce subsidies in other areas like, as I said, in fertilizer or electricity. Those will have to be evaluated and considered. But those are some of the directions, those are some of the ways in which I think we can further strengthen the game-changing, revolutionary social security system that has been built up during our government, both in the first term and now in the second term. During the pandemic, there is no doubt that inequality has grown. And when I say inequality, I mean it both in terms of individuals, so that some individuals have done very, very well and been able to increase their wealth. And I also mean it in terms of the concentration of market power in the hands of fewer companies. So this has been very much a pandemic where the recovery has been more K-shaped than it has been V-shaped, which is that some people coming out of the pandemic have tended to benefit more than others. And this is a worldwide phenomena, and there is significant discussion and debate about this set of issues around the world. Even in India, we are in fact seeing more concentration of both wealth and market power with both individuals and with companies. And we have to take cognizance of that and think from a policy making point of view, what can be done to address this. One of the very good trends that is in fact in the long run going to reduce some of these issues associated with inequality is the rise of entrepreneurial capitalism in India. You all know that India has many now unicorns. By some count, there are over 100 unicorns that have developed in the last few years. And this means that economic power, market power is diffusing across many new enterprises, that they are also becoming very competitive and very successful. And they are also creating a lot of new wealth. So this is enabling the diffusion of market power as well as some of the concentration of wealth we have seen with a few individuals. But in any case, even though this is happening, the other area that we do have to examine is what we can do to enable more income support to people. And as I said, for instance, if we consider an urban Narega, that is a way in which we can provide more support to some of our workers who are in urban areas, just like we support people who are in rural areas through the Narega program. So that is an income support program. That is a way in which we can get more income in the hands of people that need it. And similarly, if we look at subsidy programs like the farmer subsidy programs, those can also be further streamlined and they can also be enhanced so that we can provide more support to our people. Again, as I explained earlier, if we strengthen social security, if we strengthen healthcare, that also will become a type of income transfer program so that we can reduce the inequality that exists right now. You can see that the policies followed by major countries like the United States and the UK have tended to become more redistributive over time. They have become more focused on ensuring that inequality is reduced and that all families have a chance to prosper and to be able to bring up their children well. So I think whether we look at it in terms of the rise of entrepreneurial capitalism so that market power is distributed more equitably, or we look at these kinds of income transfer and distribution programs, I think these will certainly become more and more important in the future and enable us to deal with some of these issues associated with inequality. The India-US partnership is not just a strategic partnership. It is in fact a defining partnership that will shape the world in the 21st century. As I have interacted with senior policymakers and decision makers in the US, and of course understanding India's perspectives and interests well, it's become clear to me that the linkages between India and the US are getting stronger and more important day by day. Today, at some level, it is very difficult to figure out where it is that America ends and India begins, and where India ends and America begin. Because the linkages that we are forging across so many different areas, whether it is in technology, in business, in defense, in politics, in each of these different areas, the linkages between India and the US are getting stronger day by day. And the reason that these linkages, the reason that the warp and the weft of the India-US relationship is becoming so strong and so closely tied together is because of the people-to-people linkages, which are the foundation of this strategic relationship. There are now more than 4 million people of Indian origin in the United States, and they occupy positions of great importance and significance in all spheres of American life. Of course, we have Vice President Kamala Harris, whose mother immigrated from India, but we also have Sundar Pichai, we have Satya Nadella, and we have a host of famous Indians across many different spheres of life. Similarly, even in India, there are people like myself who've spent more than 20 years in America and then returned to join public life here in India. And there are so many other people in India who have strong linkages in the United States, either through education or through family linkages. So as I said, the people-to-people linkages between India and the US are just simply becoming stronger and more important day by day. Now, as these linkages, as the India-US strategic partnership becomes more important, I think there are 3 areas in which it's going to play a very influential role in the world going forward in terms of setting the rules, the mechanisms by which the world order operates. First, let's take healthcare. Obviously, we are in the middle of a terrible, unprecedented pandemic right now. And the linkage between India and the US in healthcare is enabling the world to deal with this pandemic, because we have the researchers, we have the manufacturing, we have the scientific partnerships between our two countries that enable us to mount a very massive response through vaccines in dealing with this pandemic. So a very good example of this is the biological partnership that India and the US have forged together, so that the Johnson & Johnson vaccine can be developed and manufactured in massive scale in India and then distributed across Southeast Asia and the rest of the world through the partnership between India and the US. Similarly, there are many other new vaccines, new drugs that are being developed across the India-US corridor to be able to help the world. And of course, many of the great researchers working in the US are of Indian origin, have been trained in India as well. So healthcare is a very important area where the two countries are working together. Another very important area where the two countries are working together is in technology. And again, here, a lot of the research, a lot of the new innovation is coming from the US. But India, of course, is the world's largest internet market after China, and perhaps will exceed China as well in terms of the number of internet subscribers over a period of time. And here, new technologies, new business models, new opportunities are developing every single day because of the very tight linkage between the startup and technology ecosystem in the US and in India as well. And the many unicorns that have developed in India have developed because of the support that we've gotten from the startup ecosystem in America. Much of the venture capital that has come into India has come from the US as well. So this is a way through the development of the technology ecosystem, through the development of technology standards, that India and the US can shape the world. The third very important area through which India and the US can shape what happens in the world is through the greening of our. I've been very fortunate to have had deep experience both in the business world as well as in the domain of policy making. And of course, I started as a business professional and as a management consultant and then an investor. And after having done that for more than 25 years, I came into public life. And so much of what I have done as a policymaker in public life has been influenced by what I have learned and experienced in the world of business. And what I think business teaches us is how to frame problems, how to understand what the issues are, collect the appropriate facts to illuminate the choices and decisions that one has to make, and then frame various different alternatives so that we can understand what the trade-offs are if we engage in one particular course of action or another course of action. So this analytical approach towards decision making, to understanding what our choices are and how to implement those choices, I think have helped me a great deal in policy making as well. The other aspect of business that has been very useful to me in the policy world is the whole area of implementation. And one of the things you learn in business is you've got to make the implementation approach simple, measurable, and something that is done consistently and predictably. So focusing on implementation, focusing on monitoring how the work is being done, whether the results are being obtained or not obtained, this implementation and actionable mindset, I think, is also very, very important in public life, so that you can actually get big things done. And this just requires relentless follow-up, making sure that you prioritize what needs to get done, and then just keep following up to ensure that it actually happens. So implementation and thinking through what is required to actually get work done is very, very important as well. Another aspect that I have brought over from the business world to the world of policy making is understanding of uncertainty and how you should take contingent action. So there are lots of things that are outside of your control as a policymaker, and so you have to really establish different ways of doing things that are contingent on how uncertainty resolves itself over time. So that also is something I've learned in business, this contingent decision making, how to approach uncertain decisions, and that really does help me tremendously in my policy making. And then finally, I would say that as a business person, you recognize that above all, it is the people that you have who make all the difference, the teams that you build, and how the teams work together and get things done that makes the difference between actually achieving good outcomes and not achieving good outcomes. And so again, in public life, I have tried to make sure that I work with very good people, that I build strong teams, that we think systematically about the problems that we're dealing with and come up with solutions that are going to stick. And that's another very important aspect that comes from my business experiences, is to build high quality teams that are focused on systemic interventions, that are focused on impact and know how to get things done. So that also becomes a very important business experience that carries over very, very well into policy makings. So definitely I think that as a business person coming into public life, I have tried to bring from business some of these important skills, some of these important techniques that enable you to get good things done for as many people as possible.
We've covered a diverse range of topics, and Mr. Sinha, I think you've given us a lot of insights into each of them. And I hope that we get to hear you on Swell more often. It is a difficult time for us at the moment, but there's always space for constructive and authentic conversations, such as the one we just had, about the topics which matter. And that's also exactly the purpose of the Think Tank's Wellcast. Mr. Sinha, it's been wonderful to hear your thoughts, and as I mentioned, I'm looking forward to hosting you on Swell again. Thank you so much.
I really enjoyed posting my ideas and thoughts on Swell. It's been a very productive interaction, and I have really enjoyed using this app. It's very easy to get a sense of the questions and the issues that you are interested in. And then it's very easy for me to be able to respond to those as well. So I think Swell is indeed a Swell app, and it's a very good way to have a very informed and thoughtful discussion on important and key issues. So I wish you all the very best, and I'm always available to be able to answer whatever questions and thoughts you might want from me. So once again, thank you, and my best wishes. Stay safe, stay well.